Hi everyone, my name is Nicole Poulin. I am a Community Programs Coordinator with Maine General's Peter Alfond Prevention and Healthy Living Center. And I want to talk about an effort that our organization has been involved with our local community programs to support patient needs in local businesses during the COVID-19 pandemic. So food insecurity, homelessness, lack of transportation, these were all things that our patients were struggling with on a day-to-day, even prior to the start of COVID-19. As the pandemic began to have its impact in our community, certain gaps were starting to come to the surface that we knew we needed to address. It was creating even more challenges in people being able to access basic necessities like food, medicine, and transportation to various appointments. And the biggest needs that we're seeing are food, transportation, and medicine at this time. At the same time as initial discussions were taking place, Maine General knew that we needed to have a role in making sure our community felt supported throughout this pandemic, but we knew it was going to be a team collaborative effort with other community partners, because we can't do and help people in every way on our own. The funding opportunity became available at about the same time, coincidentally enough, through the John T. Gorman Foundation. Our team applied and was awarded $25,000 that's helping support this effort. And the overall goal that we'll be using this funding to meet is increasing access to food, transportation, and medicine for our most vulnerable patients. And those include those that are recently discharged from the hospital, those that are struggling with substance use, as well as behavioral health needs, and or have multiple chronic conditions. So as I mentioned, Maine General knew that we had lots of needs that needed fulfilling in our community, but there was no way that we were going to be able to do it on our own. We partnered with Good Shepherd Food Bank, which we already previously had a strong partnership with through our Food Insecurity Screening Initiative, to help expand this initiative to the departments and programs that are serving our most vulnerable patients. And they did it with stride, and were really very helpful with that effort. And this is to provide emergency food bags that provide 2 to 3 days worth of shelf-stable food items to patients with urgent food needs. We also partnered with our local chambers, because often the emergency food bags are helpful, but for folks that are homeless or couch surfing or maybe too ill to cook, they're not able to utilize the foods that are in the emergency food bags. So partnering with the chambers, we're able to purchase gift certificates where people can use them at local restaurants to buy a ready-made meal that is available to eat right then and there. Not only is this a win for our patients that need help with food, but it's a win for our local businesses that are really feeling the financial impacts of this pandemic. We've also partnered with Kennebec Valley Community Action Program, KVCAP, to help transport patients to any sort of errand that improves their overall health and well-being, such as to local grocery stores, maybe to the food bank or a pharmacy to fill their meds. We've also partnered with local taxi companies that we have a process in place for them to use taxi vouchers with as well. As far as identifying patients in need, we've partnered with practices and departments throughout our organization that are serving our most vulnerable patients to develop standard workflows as far as how to identify the patients that might be most in need, and how we can fulfill that need with the various resources that we are able to provide through this funding. We've also educated and trained staff about the overall health implications that food insecurity can have on health, because it's just good to have a background baseline knowledge of how hunger impacts health, and helps them develop data tracking tools as well. So the data that we're collecting involves the number of staff that are trained screen patients for food insecurity, how many resource items we're handing out to patients, and what the overall impacts have been, not only for patients, but for the staff that are serving the patients and in the community as well. Successes and challenges they've been having along the way. Each department develops and implements a food insecurity screening workflow, as I mentioned. Patient screening positive, staff are offering resources to them. Departments maintain a tracking spreadsheets in a secure folder, and monthly check-in meetings are happening to discuss how things are going. So lessons learned so far is really the shared understanding that the overall goal is to link patients to long-term sustainable food resources. It's great to help people in need at the moment, but really we have to link them to long-term sustainable food resources that are already in existence. Understanding the importance of working together to help bridge the gaps that patients are experiencing, and how standard workflows and data collection can help maintain consistency. And always, communication is key. Thank you all, and thank you for hearing what we are doing.